medication scenario, case B. A patient calls into the cardiac clinic. They are scheduled for an exercise test in the morning. They're supposed to take a atenolol each morning and want to know what they should do. So when I talked about one of the nurse's responsibilities is the education and understanding how to administer the medication, this is the role. If you're maybe in an outpatient clinic setting and you have patients coming in for studies, this is going to be part of your role, is knowing what medications to hold, educating them ahead of time. Some may, in this situation, sometimes patients are called ahead. Well, often the best case scenario would be they're called ahead of time and told, okay, this is what you're going to do the day of the test. This is the medications that you're going to hold. These are the medications that you can take in the morning. But in this instance, this just shows that it's not a perfect world. So let's go to the options for this question. So either we have the patient take their atenolol, tell the patient to hold their atenolol, call the doctor, or call the pharmacist, or other. We can chat about it. So what do we know? What medication classification is atenolol? Knowing the classification, knowing the class, do we take the medications? And then think about the worst case scenario. If this patient takes the medications, then what will happen? So in this situation, know that atenolol is a beta blocker. And understanding the mechanism of action for beta blockers is that they can block the elevation of heart rate. So this person's coming in for a stress test the next morning. What is a stress test? Understanding what the diagnostics and the exams are important. A stress test is where you're on a treadmill and you're running and they're checking your blood pressure. And during that time, they are increasing. The goal is to increase your heart rate to see how stressed your heart can be, to see what your blood pressure does and what your heart rate does during that time of stress. So the test that they're doing is the stress test. The medication would potentially block the elevation of heart rate needed to stress the heart. So in this instance, what you're going to do is you're going to tell the we're going to have the patient tell the patient to hold their atenolol, because the goal of the test that they're coming in to do is to increase their heart rate. So if you're giving them a medication to block their heart rate, then it's basically a waste of time for them to do this test. And then the results can be skewed. So that small understanding of what the medication is has a ripple effect on how the patient's outcome or their plan, their long-term plan will be. So that's the answer. Tell the patient to hold the atenolol. So as a nurse, this is your counseling. This is the counseling that you would do. And then, like I said, it would block the heart rate. Okay, let's talk about the sliding scale scenario. So you are caring for a patient who is scheduled for surgery in about 90 minutes. You note the patient has been NPO since midnight per MD order. He has diabetes mellitus type 2 and has been prescribed to receive 10 units of regular insulin every morning, plus coverage according to the following sliding scale. So your patient's blood sugar is 127. So if you know the patient's blood sugar, the sliding scale is he falls within the range of 61 to 150. You know that you're going to be giving zero insulin, extra coverage of insulin. So, well, I think I went a little bit ahead of that, but understand that when you have an insulin order, that's based on a sliding scale. You want to look at the parameters of that sliding scale. Now, when we're giving insulin because the patient is eating and we're trying to make sure that there's uptake of glucose. Well, if they're not eating, then there is not, their glucose levels are generally a little bit lower. So the options of this is to give the insulin, hold the insulin for the NPO patient, do not give and call the doctor or call the pharmacist. So you notice that we're just talking generally about these 5 steps. These are not your Nclex questions, of course, are not all going to be all those 5 steps. But I really just want you to start thinking Nclexy and thinking through using your clinical judgment and all the resources that you have to answer the questions. So what's the medication classification of insulin? So knowing the classes and how to take care of them. What's the mechanism of action is what I think about when I'm thinking about insulin. Think the worst case scenario. If you give insulin to a patient, then what happens to them? What are the side effects potential side effects? So this is where you actually have your priority, just understand what the medication is and understanding the worst case scenario that for this patient. So I had talked about a little bit earlier, you're going to hold the insulin for the NPO patient.